Okay, sorry about that. I was unable to share my screen. Let me try again. Yeah, okay. So I was just sharing that how Nairobi being an urban area, the fact that a lot of things have already been mapped. So I'll share more about this site, but for now let's just see the number of health facilities that have already been mapped in Kenya on OpenStreetMap. Not in Kenya, in Nairobi. Okay, let's type your country name first. So in Kenya, in total, it's about 1,890 health facilities have been mapped, and then there's even more information on how that data looks like on OpenStreetMap. So they're saying if they break down these health facilities into types, the 409 clinics and um, you know, 844 hospitals. Then there are 583 pharmacies and then 23 facilities that offer dental services. And then individual doctors that have been mapped are 18. Um, yeah, but even just looking at the map, you can see the numbers for that. I hope I'm not cheated. You can see the numbers for like around Nairobi. You can see it's like uh, almost 80% or 70% of the total of what's been mapped for the whole country. So you can see in Nairobi there are like around 1,280 facilities that have been mapped on SM. But you can see one thing that you can see is that when you're looking at the completeness of attributes, it's very partial, meaning that for most of these health facilities, we only have the coordinates and the name of the facility, nothing else. So we are lacking in terms of services offered, working hours, if it's open on a weekend, if it's open 24 hours a day or not, which I think is very useful information, especially when you're thinking about, say, the end user, which maybe is a person who's just looking for a health facility to visit for. So you can see that
Laura, I think we lost you for some minutes.
okay, at what point?
I don't know when you started. We just had you starting sharing your screen. Then you share a little bit, then you again we missed
Okay.
you, and then you're back.
Sorry about that. I'll start again. Woo. Okay. Uh, just a
So you
minute.
can share your screen again. Eh?
Okay. So first things first. I'm really sorry about all these technical issues. I don't know. I don't know what's happening today. But I think I was at the point where I was explaining um, about like the completeness of how things have been mapped in Nairobi. Therefore, sort of emphasizing the need to shift or to include the enriching of information that's already on OSM as opposed to the creation of new features. So you see, for example, like for the past few weeks, what we've been doing is creation of new data or also modifying things that have been wrongly mapped. But as I was sharing, like that for urban centers and cities like Nairobi, you'll find out that a lot of data that has already been mapped. But what you'll notice is that most of the time it's just coordinates and maybe names, but there's no useful information that's attached to what's already on the map. So, and I was giving an example of health facilities. You can see, for example, in Kenya on OSM, 1,890 health facilities have been mapped on OSM, and you can see a huge percentage of those are in Nairobi, which therefore means that almost all health facilities in Nairobi have been mapped. But if you're looking at the completeness of attributes, which are just basically more information to these health facilities, you can see that it shows 99.8% of this is partial and not complete. So, which also just sort of proves that there's a need for us to enrich data that's already there on OpenStreet in OpenStreetMap. So, but you see, when you're looking at other counties, so when you're looking at these other counties, it's possible to now think of actually mapping health facilities because it's obvious that this is not the complete number of health facilities in these counties. Because in Kenya, I think in total health facilities amount to around 10,000, if I'm not wrong. Yeah, but in Nairobi, it's around 1,800. Yeah, and you see, by health facilities, it's not just hospitals, it's hospitals, clinics, dispensaries, pharmacies, community-based units. So it's a whole, it's so many things. So and that's what like sort of guided us to settle on this project to sort of enrich the data that's already there, that's already on OpenStreetMap, and that's health facilities. So the focus of the project would be basically to add additional information to what's already there. So say if we are mapping hospital X, can we add the number of working hours, if it's open on a weekend or not, the services offered, and all this information. And if you're wondering how this is important, I think it's very crucial, especially for an end user. So any citizen who needs this kind of information. And I was just giving an example of a movie that was produced in Kenya, but it was based on a true story. I have forgotten the name of the movie, but it was about the story of someone who was involved in an accident, and the person ended up dying, but after getting an ambulance, they actually visited around 5 hospitals. In those hospitals, they kept getting a barrier. So, say for they went to the first hospital and there was no ICU. They went to the second one, there was no oxygen. They went to the third one, and that hospital was closed at 5 p.m. and it was around midnight. So, I think for the end user it makes sense, and even I think with the recent use, like the rise in use of technology and mobile applications. For me personally, if I need to access any service, I usually the first thing I do is I check on the map what's available, what's near me, and then do that. So it's basically just increasing that information for either the end user or even for other people who might need that data for various purposes. And then I've talked about several health facilities, health services that exist. So like emergency services. What else is there? There's inpatient, there's outpatient, there's laboratories, there's laboratory services. There are things like what else is there? Surgeries. Does a hospital have a theater or not? And so much more. But then at the time when you are coming up with this project idea and sorry, and sort of working on the write up, it was during that time when there was in the news that everyone was talking about the rise in teenage pregnancies and everything. So we also noticed a gap in health facilities, and the gap was that no one was aware of the capacity that's available to offer female-based health services. So, for example, gynecology, maternity, even when you break down maternity, you're thinking about antenatal, postnatal, even under maternity, you're thinking about maternity surgery. That is something that I also just noticed today. I didn't know that there are hospitals that offer surgery, but they're not able to offer maternal surgery. So you notice that these are things that are actually not represented and are not shared. And yes, in as much as people are shocked about the numbers and everything, no one was talking about what would happen after 9 months. Like, do we have the capacity to actually for all those thousands of teenage girls to actually give birth and safely in a good hospital and all that? And even before giving birth, obviously someone needs a lot of healthcare when you're thinking about immunization and all these things. So no one was thinking about what's available. And then shortly after, we then also saw all these stories in the news of someone who gave birth at the gate of a hospital. We've seen news about I don't know, kids being exchanged or babies being exchanged at hospitals after birth, and all these weird stories about about Kenyan health facilities. So I think that just sparked the project idea on if you could find out which health facilities offer these services and what's available, and then see what you can do with that data. So yeah, so first things first was then where can we easily find this data, because no one was planning anyway to go to the field and like visit 1800 health facilities in Nairobi, doing surveys, asking them which services do you offer. And then also with COVID, and also this training program is part-time, so and it's part-time for both trainees and trainers, so no one was going to be able to carry out a survey. That would have been great, but honestly, no one would have been able to do that. Also, given the short period of time. So obviously, the next step was finding out what data was available. So the good thing is that starting from 2015, the Ministry of Health in Kenya worked together with some global okay, the project was mainly funded by USAID, and they developed a database of I'll just share my screen again. They did a survey and developed a database of health facilities, and in particular approved health facilities in Kenya, in the whole country, and then did totally broke it down into the types of those health facilities, the counties that they are in, the wards, the sub-counties. See, because health was also devolved, so it's under the county governments in a way. Then the services offered, and this data was shared openly with using an open license. So it allows anyone to download it, to use it for any purpose whatsoever, which works for us because for us to be able to also add anything on OSM, that data has to be open, or we needed to have permission to use that data officially. So that's the data that we're working with. But then I'll just open it so that you can see. So you remember when we're sharing about users and applications of OSM, and they're talking about web mapping, and explaining to people that because Google recently increased their prices for using the web map service. For most maps, it usually shows for development purposes only, just because someone did not continue paying, and this could be easily fixed by just using an OSM layer. But I digress. But anyway, so this are actually all the health facilities in the country that they mapped, and then this data has been updated continuously. So these pointers are actually for counties. So if I click on Nairobi County, then it shows me 902 facilities that were mapped, and these are facilities that were mapped and are approved. So it's yeah, they're like approved health facilities. See, obviously, we also know that in Nairobi, in so many aspects, that there are so many clinics and pharmacies that exist, but they've not been approved by the Ministry of Health. So this also helps us so that we are only adding data that we are sure of in terms of if those facilities actually have the correct approvals to operate. So you could just click further and per constituency or per ward to basically continue seeing our data. And then yeah, as you continue to the lowest administrative level unit, then you'll see the facilities themselves. But then from my end, what we only needed was the data for Nairobi County. So okay. I'll just go back so that it loads for the entire area. Yeah, so when I saw this, I was very excited because I thought that I'll get the entire data set even for the entire country with the coordinates, because it has the coordinates. But actually, when you have a look at the data and you download it, yeah, and you can see for the entire country, it's actually 12,892 health facilities. Yeah, but when you see there's an option to export in Excel, but when you export in Excel, I'm not going to do it again. But if you want to try it on your own, you can go to this link. Let me post it on chat. But because I'm not going to export because I've already done it. When you export Excel, you notice that it doesn't come with the coordinates. So, but it still works for us because most of these facilities have already been mapped on OpenStreetMap, and we also have another additional health facilities data set that now only has coordinates but does not have this. And this is also another data set that was called created by the World Bank and KEMRI. So yeah, number one, this is where the data comes from. And when I'm talking about the data, I'm talking about the metadata. So it's not the coordinates. So it's the information on, sorry, the operational status, the services offered. Because say, for example, when you scroll down here, and also when you download the Excel file, you'll notice that these are the attributes that are on your columns and everything. So say for example, if I tap on the section that shows facility service category, you'll see that it has all this information on accident and emergency casualty services, antenatal, blood transfusion, cancer screening, all basically all health services that exist. And if you click on any. So say, for example, like family planning. And then you can also choose, I can choose family planning and then choose Nairobi. I'm just explaining the process of creating the dataset that we'll use so that you have an idea of where the data came from. Then you click on search, it will reset that and only give you health facilities in Nairobi that offer family planning services. And then you can even look further. There's also long-term, natural, permanent. So it varies depending on the service category. Another example maybe would be something like HIV and STI prevention. Then you'll also see under HIV and STI prevention, there is condom distribution, HIV risk reduction. There's even prevention of mother-to-child transmission of HIV. Then you can also search and you can once you filter, you can always export your files as Excel sheets. So that was the first step, getting all this data. And since for our case, we were looking at female-based services, those are the ones that we collected or filtered from this data set. So basically, let me add. Basically, we added everything to do with from starting with antenatal care, cancer screening, because cancer screening had breast cancer screening, pap smear screening, which is for cervical cancer, and then we also added family planning, because anyway, I think in Kenya and a lot of African countries, the family planning role falls on women. So also classified that as a female-based health service. And then what else did we add? HIV and STI prevention, and then specifically only extracted the prevention of mother-to-child transmission of HIV. Then immunization. So because also for pregnant women, there's usually a number of immunization options that are offered, and then child immunization, obviously, like the polio and measles and all those things that children are usually vaccinated against. Then what else? Integrated management of childhood illness. Then obviously maternity services, which was broken down into basic and comprehensive. Then newborn care service as well, oncology as well, because there are also a number of not because there's a number, but because when you're looking at cancer, it's women that are more affected. So I guess I thought it was also important to include oncology services as well. So a huge part of before this was spent Googling on what all these services are, like oncologies for the treatment of cancer and all that. So then obviously postnatal care services was also added. And I think that was it. Then GBV, gender-based survivors, and all that. So basically, for each filter, what we were getting was the number of hospitals that offer those services. So for the filter for maternity services, then I'm getting only health facilities that offer maternal healthcare services. For GBV survivors, I'm only getting health facilities that offer services to GBV survivors. For things like cancer screening that I think was here, I can select to get everything, but since we are focusing on female-based health services, I got for breast cancer screening and the pap smear screening. So basically, that is that is the story of the data of the metadata that we'll be using. So after downloading obviously everything and then cleaning and merging, because it has to be sort of into one or into groups. So so say for example, I noticed that we have two main groups. So it was either maternal health care or cancer related services. So because for maternal we had the obstetric care, and then we had which are things that I've just shown here. The obstetric care, the antenatal, family planning falls under maternity, postnatal, what else? Then we also had birthday surgery, which iko hapa under theater services. Copy. Let me see. I think it was. Oh, it is written as operating theaters. Yeah. So under operating theaters, you can also see there's maternity, there's general theater services. So it was actually also interesting to see that the health facilities that offer general theater services but do not offer maternity theater services. Yeah, and then so grouped into two, so maternal based and then sort of cancer related. So for cancer related, it's cancer screening, then oncology, then radiology, and all that. So it was basically broken down into those two. So after getting the data, let me share the link to, in case you might want to. That's in the comment. Yeah, that's the link to the open data shared by the Ministry of Health. Yeah, and you can see hapa chini the people involved. I think it's in the main page. Yeah, on the main page you can see it was a USAID project, but then it's now being updated by the Ministry of Health as time goes by. So yeah, you can see here and everything, and then yeah, so that's where the data came from. And then maybe just another thing to mention is that yeah, while you can download the data as we did, in case you are building anything, you can also, they also have like an open API that you can use to access, and there's like good documentation for the same. Yeah, so basically you can just get that link and bookmark it for future purposes maybe. Yeah, so once you got all the data, we merged everything. Not everything for now, because I can show you my how my downloads folder looks like. But I was downloading per attribute, just to be safe. I felt like it was easier to download per attribute and then merge, as opposed to downloading the whole thing and then yeah. So I basically downloaded just as I was sharing. Like under maternity services, I have the basic maternal obstetrics something care, I think, and then the comprehensive one, and then say under family planning, there's long term, natural, permanent, short term. Yeah. So after then downloading the data, which they're basically Excel sheets in whichever format that works for anyone. The next step was then looking at how does this come to OpenStreetMap. So if you remember very well, when we've been mapping on OSM, by the way, if you have any question, I know I'm rapping a lot. If I'm too fast or if there's something that you're not understanding, please stop me and ask. when we're mapping on OSM for the past few weeks, when we've been mapping buildings, we've been mapping buildings and saying building is equals to yes, and that is in OSM that is what we call a tag. When you're mapping a school, we'll also like write things, something like amenity is equals to school, or amenity is equals to something. So, and tags usually, I think we shared this earlier as well. OSM tags have a key and a value. So the key is usually the thing that comes first and then the value. So, and a key can have several values. So say, for example, building is equal to yes. Building can also be equal to something else. Yeah, so basically that's how we've been mapping on OSM. Or even a good example to use would be roads. Maybe I could try and open OSM just to show in case it's not that clear. A good example, I guess, would be roads. Where you can map a road and then select the type and say minor road is equals to track, something of the sort. I'll just pick a random road. Click on edit. I'll not save this, it's just for showcasing purposes. Okay. So say for example, I don't think I even have to edit. So if I click on any feature, okay, yeah, I can see that it's a residential road, but for you to select a residential road, usually you have to go to minor roads. Then there's a residential road option. So meaning in this case, the key is minor roads, then the value is residential road. I hope that makes sense. Same to say, for example, a building. It shows a crowded area. It's taking forever to load. Just a minute. Yeah, but I hope it makes sense. Yeah, like we use tag. In OSM, if you map a feature and you do not select a tag, it's usually an error, and it's usually the thing that can pop up at the when you're uploading your changes. So yeah, same way now that you see we have health facilities, and we have now gotten the offered. And yeah, another thing that was coming with this data was the working hours, the number of beds, the number of cots, the operational status. So it was not just the health services. So that's why I really loved the data set that I got here. So you can see if it's open for the whole day, if it's open on public holidays, if it's open on weekends or not, if it's open late at night. Then these are the services that are now merging into the main list. Yeah, so the next step, since we are planning to add this to OSM, like basically this last rows, is these are the things that we want to add. The next step is to find out if I have the options to be able to add these things. So say for example, let me if this is loaded. Let me see if I'll be able to get like a building. I think it's easier to explain that using a building. So yes, so say for example, I was sharing for a building, the first thing that you usually select is when you select this building tag, the key is usually building, the value is usually yes, and then if you have the name of the building, then the key is name, then the value will be the name of this particular building. Then this is the building yes tag, and then if I knew the floors, the number of floors in that building, the key would be levels, then the exact number of floors in that building would be the value. So yeah, that's just to explain the tagging system. And You can also see down below as this has been added. And actually, it's for all features on OSM that have all this system. Even for something as simple as a tree, a tree, you'll notice there's a leaf type. Let me just try adding something. So say if I wanted to map this tree, you can see that there are more tags that I can add. If it's, I can select if it's broadleaf, middle-leaf, leafless. Yeah, that's just to explain the tagging system. Yeah, so basically that's how OSM works. Like you cannot add a tag that does not exist, and there are a number of approved tags. So as I was just sharing, the next step after getting all this data was to see, do I have the available tags to be able to add all this data into OSM? So where do you go to for that? You go to the OSM wiki page and you look at tagging. So, and when you go to tagging, you'll see there's a category for health facilities. Okay, yeah. So you can see this is a tagging page. You can just Google OSM tagging and then should come up. But I can share the link as well. Okay. Just a minute. Okay. Yeah, so you can see that, so I selected the tagging based on categories, and you can see there's something for agriculture, there's something for boundaries, commerce, conservation, infrastructure. So for us, we are interested in the health tags. So basically just click on health. Yeah, and then I started to have a look on everything, what's available, what's not available. So, and once you open, and you can see like, you can see that there's a key, under health, there's a tagging system where key is healthcare. So I can open that. Okay. Yeah, so, and when you open that, you can see under healthcare, where healthcare can be used as a key, there are several values, like there's alternative and there's explanations for each. There's audiologist, birthing center, blood bank, etc. So for my case, since I'm looking for, I was looking for, since I have all this data that I've gotten, I was looking for antenatal, I was looking for pediatric, and all that information. Under maternity, I was looking for maternity services. And basically, under maternity, we had obstetrics and then gynecology. So I needed to see that and make sure that those tags exist, right? So first thing, so that there are those that exist and there are those that do not exist. Because say, for example, you can just go through this. You can see there's one for gynecology, but you can see like the tag that's available for gynecology on this, it generalizes for two things. But for me, I wanted something separate for obstetrics and something separate for gynecology, because there's some health facilities in Nairobi that offer one and not the other. But with this system, it would be assuming that if I tag by gynecology, it actually offers both. So yeah, that was the next step, like identifying if what I have on this from this data set is what can be matched to the tags that are available on OSM. So actually, there are a number of things that are not available. That is what I was sharing in the beginning, like some of the challenges that we are experiencing at the moment. So what I added on this sheet is what's available. So because we have antenatal, we have pediatric, and you can also just Control F and search. It doesn't have, you don't have to. to go through the entire list, and then you can see that there's one for pediatrics. Then there are also pages for each if you'd like to read more. There's also one for surgery, so that works as well. So what I've added here is what's available in terms of tagging. So yeah, antenatal, pediatric, then there's so for maternal we go with gynecology because it covers for both gynecology and obstetrics. And then there's also radiology. Yeah, so basically these sheets within this spreadsheet that I created they are for the tags that exist. But that also means that then there are some things that we have excluded for now just because we'll not be able to tag them on ourselves. But we are actually consulting on that. Yeah, so that's the story of the data. I just wanted to share that first so that when you continue mapping, you sort of understand where the data is coming from and everything. Are there any questions up to that or comments or thoughts before then I go into the process of now adding, of how we'll be editing? Any question? Okay, you can see a comment that if one wants to. That's I think that's what I was sharing at the start. So ideally, if we had more time or if we had more time to carry out the project, what we would have done is we would have gone to Inquire, or we would have edited the data that's on SM using what we're reading. Also, say for example, if I have ever gone to Kenyatta National Hospital and I know I went for this service, then I could edit on SM basing on that experience. But now, since we already have data from the Ministry of Health telling us that you can get these services here, then that's why we are just going to use their data, as opposed to us going physically to the health facilities to actually collect the data. So yes, you can go to a health facility to find out what kind of information is available, but from my end, I think if there's openly available data, then why not just use it as opposed to going to the field to actually collect it. So yeah, if you can, you can go, but you do not have to go. So did you so I have not deleted them. So because you see, remember the way I downloaded everything, I downloaded everything separately. So I think actually also downloading separately helped me, because if I had downloaded the whole thing, it would be a lot of work. Now trying to clean the data to remove the sections that do not have tags. But then you see now, because I downloaded, where is it? Close both. Because I downloaded everything basically per tag. Like I downloaded for radiology separately, for operating theater separately and everything. Then what I just did when I looked at what was available and what was not available, what I've added to this sheet here, this spreadsheet, it's what is only available, like the tags that are only available. But once we get a way of a workaround for that, then we'll also just add the remaining ones, because anyway, the remaining ones are not, I'd say they're not main, I think with maternity, antenatal, and cancer screening and all that, I think those are the main ones. And then once we figure out what to do with the rest, then we'll be able to do that. Because you see, how also tags work is you can also propose a set of tags. Say for example, and these things usually vary per country or per per region. For example, for roads in Africa, we have a different tagging system for roads in Africa as compared to other areas around the world on OSM. So one thing that when we're having discussions about this today with some people at HOT, yeah, we're talking about if it's possible, then even if for now we can be able to map what we have at the tags for, and then if after this, then we can sort of create a document proposing new tags to be added, even if they'll be country specific for Kenya alone, then that would work. So we've not deleted, the data is still there. And also when you're editing OSM, we'll just only be adding what we have and what you're sure of. I hope I've answered that, Grace. Okay, cool. Any other question before we continue to the last part now? Okay, if there are any questions, we'll answer as we continue. So, yeah, no, I guess now I'm thinking, then now how do you get, because now we have the data, we have all the metadata here, and we have health facilities on OSM. So I guess you're wondering what to do next. So there are two ways that this can be done. The first way would be directly through OSM. So say, for example, I'll just choose an example here. The easiest one would be the cancer-related ones. Juicy Mingi. So did we have a thing for cancer screening? No. Okay, go with the oncology ones, which is also cancer related. So two ways that this can be done. The first way would be to search for. So see, so basically, you are matching the data on the Excel sheet to OSM and then updating the data on OSM using this. So the first thing to do would be to search, one of the ways. So I'd search here Aga Khan. Oops. Is Aga Khan written that way? Hospital. Then it would bring a list of names. So you can see there's Mombasa. Mombasa Road, not Mombasa. So I can have a look here. But this is in Westlands, Parklands. Can already see this process is already way harder, which is why we won't use it. Because, okay, did I also limit search to my extent? No. Okay. Just a minute as it loads. I don't know, it only shows, does not show the one in Parklands, unless it's not been mapped. Okay. It's not this one, it's not the one here. But basically, let me just use this as an example, although this is not it. But ideally, you'd search for the health facility, click on it, click on edit, and then once you click on edit, then add all these things, all these tags. So since we were here on oncology, yeah. So but ideally you would start maybe with everything. So you maybe go with beds. It's 243, 0 cots. So you just click on under tags. You click on the plus, and if you start typing, it will come up. Then you just type in. It's that easy. Okay, it doesn't have quotes, but then you would look at the other attributes. So oncology. So for oncology, it's healthcare specialty is equals to oncology. So basically, that's just what you enter, or you could add it through here. Under specialties, just type. You can start typing, then just select oncology, then add all the specialties that exist. I'm sure, let's see if you type something that does not exist, what happens. Because someone was also telling me that you can you can add tags, but I think those would be errors. Yeah, because you see, if I type chemotherapy, it only brings what's available, and what's available here it's biochem. But I guess you can add tags that. Yeah, so basically that would be a process, and you see it's an edit, and then you just you upload, so you could continue to the next one, continue saving that way until you edit all the ones that you want. So say for example, if you're working on this oncology section, you just do that for this 18 facilities. But you see, I don't know, I feel like using directly on OSM, you have to cross check the services, and you have to know the tags. So you sort of cross-checking from the data that you have to the tagging system, then to OSM, then everything. But then comes in this other site. I don't know if any of us ever explored it when COVID-19 came, but healthsites.io is a site that it's basically the only open global platform that has data on health facilities for the entire world. And it's a project that started as a response to things like Ebola and other health-related disasters. So that's how it started. And how it works is that you can edit OSM. It's fully OSM based, so you can edit OSM directly from health sites and everything. So I think they post the link on chat for health sites, but it's healthsites.io. I guess this is also just another site to bookmark in case you're ever working with data you're working in maybe for project in another country and you need health facilities data. A good site to have a look at. And also, we've not had our session on downloading OSM data, but I guess this is also one of the easier ways to download health facilities data from OpenStreetMap. So if you're on the site, yeah, I've shared the link on chat, but it's healthsites.io. On the page, what you'll see is edit the map, how it works. You can look at how it works. It just shows the architecture, and it shows that changes on OSM go to the OSM database and everything, but also changes that can be made, that are made on the health sites platform where we are also sent directly to the OSM database. Yeah, so it's basically OSM based. So everything that It's like editing directly on OSM through another site. I guess that's the simplest way to explain it. So you can click on edit the map if you're here. So the first thing to do would be to sign in here. So let me sign out. Okay, I hope it doesn't sign me in. Yeah, then if you click on edit the map at the top, you can click on sign in, then you just grant access to your OpenStreetMap account. Yeah, then it will load all health facilities in the world. So you can zoom into Kenya. Yeah, and then yeah, so once you're here, things that you can see, obviously you can see a map, and then it's obviously these are health facilities. They're sort of grouped together during Mingi. Then you can actually select per country, so you can upper there's a drop down here under country, so you can select Kenya. Then yeah, you can see what we did, what we're sharing at the start. Gives you a summary of the number of clinics, hospitals, blah blah blah, all that info. Then it shows the latest updates to health facilities in Kenya. I see the last one was 22nd of January by me. I actually can't remember. 22nd is Juicy, so I don't know. Yeah, so that's basically how it looks like. You can download the data for Kenya. You can see the last it was updated in terms of new locations coming in or attributes coming in was Wednesday, December 30th. So if you don't mind that, you can download it from here, or if you maybe think there's maybe edits, you can just download directly from us, which we'll share soon on the different ways of how you can download the SM data. Yeah, so then how do you edit? So you've shown the process on OSM, if you're editing directly on OSM. So on health sites, it's similar. So you also need to zoom in further before this edit button can appear. Then you can click on a facility. You can see it will give you the name, what has been mapped. You can see what has been mapped here, it's just the name. Then on a SEM, it usually picks the road that facility is along. Even for buildings, it usually picks the road where that building is along, and then it shows it's a hospital. And then what was added is emergency services. Yes, I can see the number of beds are not here. Number of doctors, it's not included. Ownership status, it's not included. Services have not been included. No phone numbers, no operating hours. So I'm able to click on edit and actually edit this area if I know it, but I do not know it, so I'll cancel. So just a minute. So okay, I was comparing this to the editing process in directly to OSM. I think the interface is much better here. And then if I click on edit, say for example, for this hospital, like everything has already been broken down for me. So you can see the name. I can see up here, I can click if it's a hospital, if it's a clinic, if it's a pharmacy, or if it's just individual doctors. And this is information you can get from our data. You can get that here on facility type category. And then continuing, you can see what else? You can add the city names, obviously for zote zitakuwa Nairobi. And then it's also easy now to choose the specialties. So alternative, birth center, dentist, doctor, hospital, lab, etc. Also all this information. Yeah, I don't. Basically the difference between this and OSM, you do not have to know the exact tags and the exact key value combinations, because you see for OSM, I need to know what to choose here. But for health sites, I just need to tick. What is on my list, and that's it. So then I just fill in number of beds, number of doctors. We do not have that. Then if it's private, public, that is also info that we have here. On the ownership.